welcome back to this channel. So we have started with the second inflammatory and reactive disease of oral and maxillofacial region, that is peripheral ossifying fibroma. So the main difference between peripheral ossifying fibroma and pyogenic granuloma is that peripheral ossifying fibroma is more firmer, ज़्यादा firm होता है. Second, it is found in young adults rather than pyogenic granuloma is found at any age, and women predilection is more in peripheral ossifying fibroma. Okay, and we have seen that ossification and इनका जो origin है वो connective tissue of PDL से, and pyogenic granuloma is mainly from interdental gingiva. Okay, now we'll be continuing pyogenic peripheral ossifying fibroma. Let's start. Treatment: local excision with 2 mm surgical margin at the periphery of the lesion and the deep margin to include its PDL origin. So local excision with 2 mm surgical margin and at periphery of the lesion and deep margin to include its periodontal ligament origin. तो ये इंक्लूड करना है हमको. रिकरेंस इज 20% इफ़ PDL इज़ नॉट इंक्लूडेड. अगर हम लोग पेरियोडोंटल लिगामेंट कॉम्प्लेक्स नहीं इंक्लूड करते हैं तो रिकरेंस होगा. देन रिमूवल ऑफ द एसोसिएटेड टूथ इज़ नेसेसरी. तो फिर रिमूवल ऑफ एसोसिएटेड टूथ विल बी नेसेसरी. अगर रिकर कर रहा है तो हमको वो एसोसिएटेड टूथ भी हटाना पड़ेगा. Okay, now we'll starting with the third, that is peripheral giant cell proliferation. So before starting this, let's revise the two of them. पहला था अपना pyogenic granuloma. ओके, पाइजेनिक ग्रैनुलोमा में हम लोग ने सबसे पहले देखा था कि इट्स अ मिसनोमर, इट नाइदर प्रोड्यूस फर्स्ट नॉर इट इज़ ग्रैनुलोमैटस. सेकेंड, we have seen that it is a soft tissue, fleshy, easily bleeding red mass. Third, we have seen that it arises from interdental gingiva and it occurs at any age. Then we have seen that it is a red purple color mass, can be ulcerated sometimes, and it can also occur on lips, tongue or buccal mucosa. Then we have seen that the two types of pyogenic granuloma, first is pregnancy tumor and second is pulp polyp. We have seen both of them. पल्प पॉलिप भी हो सकता है, प्रेगनेंसी ट्यूमर भी हो सकता है. नाउ पल्प पॉलिप इज सीन इन चिल्ड्रेन एंड प्रेगनेंसी ट्यूमर ऑब्वियसली जो हार्मोन स्टिमुलेटेड जिंजाइवा होंगे लाइक प्रेग्नेंट वीमेन उसमें देखेंगे. These are two of the variant, or we can say these are two of the types of pyogenic granuloma. And we have seen that it has granulation tissue, endothelial cell and capillaries. That was all about pyogenic granuloma. Then we have seen peripheral ossifying fibroma. We have seen that it is more firmer. It has a broad base. 3 things we have seen: young adults, women, and anterior quadrant of either arch. And then we have seen that origin is connective tissue element of PDL. Ossifications are found. Then mainly plasma cells दिखते हैं इनमें. When we see histologically, plasma cells are seen more commonly here. And that's all we have seen. Then we have seen the treatment part of this peripheral ossifying fibroma. treatment plant हमने देखा था कि वो PDL के साथ ही उसको रिमूव करना, वरना रिकरेंस ज़्यादा होता है, और बाकी दोनों को एक्सरसाइज करना होता है 2 mm मार्जिन के साथ एट इट्स क्लिनिकल पेरिफेरी. ओके, नाउ we'll start. Hope these two terms are clear. We will be starting the triad of gingival mass, that is peripheral giant cell proliferation. Okay, we have completed pyogenic granuloma and peripheral ossifying fibroma. I hope these two terms are clear, and we'll be starting this peripheral giant cell proliferation in the next class. Okay, till then, like, share, subscribe and comment. Bye.